Good evening. Welcome to tonight's event. Thank you all for coming. My name is Rob Pritchard. I'm currently an oncologist and chair of the Cancer Committee at Martha Jefferson Hospital. On behalf of Martha Jefferson Hospital, I'd like to introduce to you tonight to this evening's speaker, Dr. Otis Brawley. Dr. Brawley wears many hats. He's currently professor of hematology, oncology, medicine, and epidemiology at Emory University. He's a member of the Centers for Disease Control and Prevention Advisory Committee on Breast Cancer and Young Women. In addition, he serves as the Chief Medical Officer for the American Cancer Society and is responsible for promoting the goals of cancer prevention, early detection, and quality treatment. Dr. Brawley is an acknowledged global leader in the field of health disparities research and is a key leader in the American Cancer Society's work to limit disparities in access to quality cancer. He's received numerous awards during his career, including a key to St. Bernard Parish for his work in the U.S. Public Health Service in the aftermath of Hurricane Katrina. He's here tonight to share with us his book, How We Do Harm, A Doctor Breaks Ranks About Being Sick in America, and his thoughts on healthcare today. Please join me in welcoming Dr. Otis Brawley.
Thank you. It's wonderful to be here. I want to say thank you to the organizers for the Virginia Festival of the Book. I want to thank Ms. Faye Sothersby, Dr. Rob Pritchard, and the staff at Martha Jefferson Hospital for sponsoring me. I also want to thank Dr. Charlotte McDaniel, who's a wonderful ethicist, for arranging for me to come here and talk to you today. A little bit about me. I was born in Detroit, Michigan, and I had the fortune of attending a Jesuit high school. I ran across some very good Jesuit priests who instilled on me some thinking about ethics and some thinking about social justice. And I went on to go to medical school and have actually applied many of those lessons as I've practiced medicine for now nearly 30 years. Sorry about the feedback. One of the things that one of the Jesuits told me early on, a fellow named Richard Polakowski, is that we should always remember what it is we know scientifically, what we don't know, and what we believe, and we need to label them accordingly. When I went to medical school, he reminded me that doctors have an extremely bad habit of confusing what they believe with what they know, and after 30 years of practicing medicine, I've determined that that is incredibly, incredibly accurate. I trained as a medical oncologist and an epidemiologist to start looking at outcomes, what things work, what things don't work in terms of treatment. And over time, I realized there were tremendous disparities in medicine. There were people who had incredibly bad outcomes because they did not get enough health care. But the big surprise was there was a group of people who had incredibly bad outcomes because they got too much health care. And hence the title of the book, How We Do Harm, talking about those who don't get enough health care, those who get too much, and the realization that we could do better in terms of our healthcare system if we actually were a little bit more rational in how we practice medicine. Indeed, many of the politicians will scare the American people by talking about rationing of medicine, and they got the root of the word right. We need to be rational in our practice of medicine. That's a little bit different. At the same time, started looking at healthcare costs. You know, we spent $2.7 trillion on health care in the United States in 2011. I don't know what to do to stop that. $2.7 trillion is an awful lot of money. We spent $1.1 trillion on food that year, and it was $2.7 trillion on health care. It amounts to about $8,100 for every man, woman, and child in the United States. Now let's compare that to other countries. If American healthcare were an economy, it would be the 6th largest economy in the world. We spent $2.7 trillion on healthcare in the United States, and there was $2.6 trillion spent on everything in France in 2011, the sixth largest economy. We spent $8,100 for every man, woman, and child on healthcare. The second most expensive country is Switzerland at about $4,300 for every man, woman, and child. At the same time we're spending all of this money on healthcare, our outcomes are not very good. 49th in life expectancy overall, 25th or 26th in infant mortality. When we look at things like white male life expectancy, we are 4 years different between the United States and Canada. We like to bash the Canadian healthcare system. Canadian healthcare system is more than half the price of the American healthcare system on a per person basis. I actually started realizing that the incredible cost of healthcare in the United States was actually depressing the economy of the United States significantly. If we were Switzerland, the second most expensive country in the world, if you owned a company that employed about 300 people, that company giving health care to all of its employees, the average cost in Switzerland would be about $10,000 a year for a family. The average cost in the United States for a family health care policy for an employer in 2011 was $18,000. Now just imagine if you had all that savings, instead of employing 300 people, you might employ 305 or 306. And if you apply that across all the various small companies in the United States, very quickly a 7 or 8% unemployment rate would become a 5 or 6% unemployment rate. So you see healthcare is already negatively affecting the United States. At the same time, we have these incredible costs and we have outcomes that are not very good. Even in cancer, my own field, we have outcomes that are not very good compared to other countries. I started realizing that there was this underlying corruption in medicine, and that's what I wrote about in my book. Now, when I say underlying corruption, it involves not just greed. There's certainly a problem with a lot of folks who want to make money, and it's the doctors, it's the hospitals, it's the health insurers, it's the drug companies. The amazing thing I realized, it's even the patients that are part of this underlying corruption. And it's not just greed, it's actually a corruption of a lack of respect for science and a lack of respect for what we know. And in many respects, it's this mindset problem. It's getting back to what Father Polakowski talked about, confusing what we believe with what we know. Let me give you some examples. In 1903, Dr. Halsted told us how to do the mastectomy, the breast cancer surgery, removing the breast for breast cancer. And he described going all the way down to the ribs and up to the third level of lymph nodes. And a woman who had a Halsted mastectomy in 1903 was unable to raise her arm higher than this for the rest of her life and always had swelling in the arm. We did the Halsted mastectomy well into the 1980s in the United States. In the 1930s and 40s, there were doctors who were saying, do we need to be doing this severe an operation? Some of those doctors actually lost their academic careers because they questioned the Halsted mastectomy. They got fired because they wondered if the Halsted mastectomy was an inappropriate operation, and Halsted had been dead for 20 years. Quite honestly, Bernie Fisher from the University of Pittsburgh and another physician in Veronese from Milan did a series of clinical trials with great difficulty in the 1960s and 70s that ultimately showed that instead of removal of the entire breast, that incredibly morbid procedure,